I'm doing my medication administration video. Here's a room scan. Well, I got my table here where I will be doing my brain dump, Hannah as my patient, and then I have both of my orders there where I'll be doing my second check, and I'm gonna have Hannah time me for my brain dump. Okay. I'm brain dumping now. All right. Okay, so first I'm gonna start with just my med cards first. So for the medications that we have today, oxycodone and codeine, which are the pain meds, which we will not be giving because our patient is not experiencing any pain. And then digoxin and furosemide we will not be administering because of the potassium levels being already low and they've been trending down. Right now he's at a 3.4 and the potassium ranges from 3.5 to 5.0. And then as far as the digoxin level, or dig level, he's at a 1.9, which is in range of 0.8 to 2.0, but again, because of the potassium already being low, we don't want the cardiac output to continue to decrease, making Joe Smith's heart work even more than it has to. Then we have warfarin, which will be the med that we are administering today. Looking at the INR levels ranging from 2.0 to 3.0, he's within the range at a 2.7. And then as far as some considerations, we're looking at monitoring the blood pressure, which we already did, and he is at a good range for this medication. Then we're also looking at any increasing signs of hypertension. We wouldn't be giving to patients that are pregnant. Joe Smith is not pregnant. And then also we're assessing any needed dosage changes within, every 1 to 2 weeks. Then just for some questions for you, Joe. Are you experiencing any bleeding gums? Nope. Any scabs? Nope. Any black stool? Nope. And what kind of toothbrush do you use? Soft. Perfect. Okay. So, the drugs are good. As far as the one we're giving is warfarin. So I'm gonna move over here. And are you in a comfortable position? Yep. Okay. So I am going to prepare your meds. So I will be right back. And then also, since I already got the blood pressure, I will not need to sanitize any equipment because I don't have any. So I'm going to start by comparing the MAR with the provider's orders. So looking at the drug that we are giving today, which is warfarin, it is for Joe Smith, date of birth 10/05/1954. The medication has not been given yet. It is a daily med, so this will be the first time administering today. Looking at the milligrams, it is 5 milligrams on both orders, and then also PO, and we are giving it for his atrial fibrillation. And again, the medication has not been given yet. All right, so I'm going to put the provider orders away. So I'm just putting it under the MAR, and I'm going to look at Joe Smith's drug drawer, and I'm grabbing out warfarin. This is, again, for our first check, looking at the MAR for Joe Smith, 10/5/1954, warfarin, a 5 milligram tablet, which this is also a 5 milligram tablet, so I will not need to do any cutting or splitting, crushing, any of that. So the dosage is checked 100% accurate. It is for PO daily. The med has not been given yet, so this will be the first time administering today. And it is again for his atrial fibrillation. Looking at the integrity of the package, it doesn't look like it's been ripped or previously opened. Also looking at the expiration date, it is 12/31/2034. So the drug is not outdated. So then I'm going to place it in my med cup, and I'm going to move on to my second check. Okay, so pulling my med out of the cup, and again I'm looking at the MAR, and then I'm looking at, this is for Joe Smith, 10/05/1954. Making sure that it's both warfarin, that it is 5 milligrams, which the dosage on here is also 5 milligrams, which is 100% accurate, so I won't be needing to split it. It is PO daily. The med has not been given yet, so I'm able to administer it, and it is also for his atrial fibrillation. Again, looking at the integrity of the packaging, it is not opened or any signs of being opened. And the expiration date is again good, not expired. Placing it back in my cup. And I'm gonna move on to my third check. So, put this back over here. Okay. Hello, I'm Alyssa. I'm gonna be your student nurse today. And hygiene. The door is closed for privacy. Can I get your name and date of birth?
Joe Smith, 10/5/1954.
Double checking on the wristband. Also, while I'm here, I'm gonna scan it. Okay. Any allergies at all?
Yeah, 2 sulfa and betadine.
Okay, perfect. So I will be using gloves in this assessment, which I'm grabbing some. Okay. Then I'm going just to check the MAR. So we are giving warfarin. This is going to be for your atrial fibrillation. Are you sitting in a comfortable position?
Yep.
Okay. And then do you have any questions or concerns at all?
No.
Okay. So first I'm going to start with some information about the drug we're giving. So we're giving warfarin today, which it has not been given yet. This is how it works is it interferes with any blood clotting, and it's used for any pulmonary embolisms or in your case atrial fibrillation. And then some side effects would be common, start off with nausea, cramps, rash, and fever. And then more serious ones or life-threatening would be hemorrhage or anaphylaxis, which we will be looking out for. So can you tell me a little bit about warfarin?
I'm taking it for my atrial fibrillation.
Okay, perfect. So patient was able to teach back, so that's good. Are you able to swallow your med with water?
Yes.
Okay, so that's good. And then again, I already took the blood pressure, so that's good. Let's see. I would cleanse my equipment, but I don't have any, so that's fine. I'm going to scan the medication here. Boop. And it is for warfarin of 5 milligrams. Again, I don't need to split the medication because it is already at the needed dosage. Okay, I already said that the door is closed, that I will be using gloves further on. I checked the MAR. I did my introductions. Okay. All right, so we're moving swiftly onto the third check. So, looking at our MAR again, we're making sure that it is for Joe Smith of 10/5/1954, that we are giving warfarin at 5 milligrams PO daily. Med has not been given yet, so we will be administering it soon. It is for atrial fibrillation, and then again, the package is good, not expired or anything. Okay, so, I'm gonna put my gloves on. Again, do you have any concerns before we begin? No. I grabbed the wrong size gloves. And you're sitting in a comfortable position?
Yep.
Can I asked if you had any concerns. Okay. Alright, so I'm gonna take the med out, maybe. Okay. Okay. Med and cut. I'll go on the side. Okay. There's that. Okay. Water. Perfect. Okay. You open your mouth. Alright, the med has been swallowed, so that's good. Okay, I'm going to treat that at 12:05 under warfarin. Alright. Okay, I'm going to remove my gloves and then hand sanitize. 5 moments of hand hygiene are before entering a room, before touching a patient or their belongings, after touching a patient or their belongings, after coming in contact with bodily fluids, and before leaving the patient's room. Okay. Are you still in a comfortable position?
Yep.
Okay. Then I'm going to make sure that the patient, do you have any concerns for me or questions at all?
One.
Okay, good. So then I'm going to make sure that the patient's bed is down and locked and bed rails up if wanted. The call light is within reach and that the bedside table is within reach and that also the room is clean and clear of clutter. I would sanitize any of the equipment that I use and then I'm going to make sure that I document everything. Then again, with this med being that it was given orally, I'm going to make sure that I come back and assess the patient in 30 minutes. If I notice any adverse effects, I would make sure to hold the next medication, assess their vital signs. I would notify the prescriber and the provider, and then also the pharmacy, and then I would document it. And then any abnormal findings, I would also document it, and then I would also make sure that I document as well that the med was given and which ones were not given. And then that concludes my assessment.